This orbital accentuation demonstrates eyelids which have been saved, allowing a narrow entry into a cavernous socket, requiring a flexible, collapsible balloon to position the superior lid posterior and superior to provide acceptable gaze for bilateral symmetry. Comfort and position of the prosthesis is evaluated. Critical evaluation is then reviewed, and eyeglasses are positioned for final evaluation. This 55-year-old male required a rhinectomy to remove basal cell carcinoma. The entire alloplastic procedure is explained to the patient, and questions the patient has are fully answered. A post-surgical alginate impression of the existing nasopharynx is begun. Quite often 2, 3, and sometimes 4-piece impressions are required to ensure ease of removal of the impression material while still maintaining most accurate internal mid-face anatomy. While the alginate is still liquid, some shaping can be done to improve the surface for an additional layer of alginate. Ink marking upon the skin is done to identify the midline and enhance facial landmark anatomy. These lines will reverse onto the final cast stone mold.
Okay, Gary, are you ready? 4.
A space is left at the top of the reservoir mask for fast-set stone plaster to prevent the alginate from distorting when impression mask is removed. The entire external impression is removed. The internal impression is gently removed and placed onto the corresponding cradle shape of the external impression. The silastic intrastructure or posterior bubble is removed from the plaster cast and placed into the existing wound. The intrinsically pigmented silastic external nose is vulcanized with the posterior bubble to form a hollow single-piece, self-retained nasal prosthesis. The hollow, lightweight prosthesis is inserted, evaluated for comfort, fit, and appearance. Extrinsic pigmentation is completed to demonstrate a comfortable, self-retained, hollow nasal prosthesis, which requires no medical adhesion.
NBC Network News did a documentary on a patient that had had a maxillectomy, an exoneration, and a palatectomy, as demonstrated here. Patient has the prosthesis in place. It is hollow and lightweight. We involve the families as much as possible to participate in the alloplastic reconstruction. The support is very important. They usually work together